Welcome to Clinical Documentation and the Health Record. We will be talking about and discussing various topics in Chapter 2. We will discuss the purpose of health records, describe the function of clinical documentations and health records. We will list various ways we use the health records, as well as explain the importance of defining the legal health records. We will review documentation requirements in the health records, as well as discuss factors driving healthcare organization toward the electronic health record. All right, so let's get started. So, who documents clinical information? Regardless of the healthcare setting, healthcare organizations must meet regulatory and accreditation standards when collecting and storing health information. These standards require a separate health record for each individual patient. The standards also address minimum documentation requirements to ensure that these records provide for continuity of patient care. The health record serves many purposes, such as documenting services for quality of care, reimbursements, and outcome management, protecting legal interests, and reporting for public health, and supplying clinical data for research, as well as support the operational management of healthcare organizations. Healthcare providers are required to document the clinical service they perform on behalf of the individual patient in order to support the care provided and the billing that's submitted. Healthcare providers include licensed practitioners such as physicians, psychologists, clinical social workers, nurses, allied health professionals, and licensed independent practitioners. The documentation that compose of legal health records may physically exist and be stored in a combination of electronic paper and computer databases. Okay, the result is what we call a hybrid record. Regardless of the format, specific data elements are required. Accreditation standards, licensing requirements, and federal and state determines the specific health related information that must be collected for each patient. Standards and regulations specify when the information must be collected, and also is specified by whom. So the content and style of clinical documentation, it depends on a combination of factors, including the profession and the specialty training of the healthcare provider. Give you a couple of examples. The physician, either, for example, the surgeon, the practitioner, the nurse, midwife, or such as a respiratory therapist. So the purpose and value of documentation is very important. Federal state status licensing requirements and accreditation standards provide minimum guidelines to ensure that there is accurate and complete documentation. So this documentation facilitates effective communication among the caregiver to provide continuity of patient care. The health record is the document, or the healthcare caregiver provider, the document that the healthcare provider used to collect and store clinical data for individual patients. In the context of the overall healthcare delivery system, health records serve several important purposes, and just to name a couple, it ensures continuity of patient care among providers and along the continuum of care. It provides a mean for data analytics, for evaluating outcomes, trending data, and for filling administrative reporting. It provides a mechanism for monitoring quality-related issues, supporting peer review activities. And peer review is an evaluation of work by one or more people with similar competencies as the producer of the work. It also provides the health record also provides documentation to substantiate reimbursements, claim submissions, and medical necessity of care. Health records are used for protecting the legal interests of customers, caregivers, and health care organizations. It provides clinical data for biomedical research, supports professional education and training for physicians, nurses, and allied health professionals, and it supports operational management of healthcare organization and provides health service data for public health planning and government policy making. So who owns this data, right? Who owns the health record, the data within the health record? Health records and other documentation related to the patient's care are the property of the hospital or healthcare provider that created them. However, the information in each record belongs to the individual patient. So to ensure their validity and confidentiality, original health records must be maintained under the facility's physical control, except in certain legal situations. So consumers have a right to control how information in their health records is used. Patients can review, copy, or amend their records when necessary. However, outside healthcare providers, third-party payers, clinical researchers, and others have a legitimate interest in the content, the data that's within the health records. They also need to access the health records. So these people that's considered third-party payers, they have an interest and they want to be able to access that health record. So how do we meet the growing demands for healthcare information, right? So there is a growing demand for this healthcare information. How do we meet that demand? Hospitals and other healthcare providers, they must develop a process for fulfilling legitimate requests for health information while protecting the confidentiality of the health record and the privacy of the patients. Also, hospital and providers, they must ensure their records remain accessible for legitimate purposes for a reasonable period after the health care episode is complete. In the hospital settings, health information management professionals primarily manage the privacy and confidential of health information and the security of health records. The implementation of HIPAA, the Health Insurance Portability and Accountability Act, which this rule came about in 2002, they established a consistency, or the privacy rule in 2002 established a consistent set of privacy and security rules, and now these rules are designed to protect the privacy of patients, but also attempt to simplify the sharing of health information for legitimate purposes. So, for example, Before implementation of HIPAA, the health provider who needed access to a record maintained by another provider usually could not directly request the information. The former provider required the patient's written authorization to release information to the current provider. So in many cases, the patient or the patient's legal representative had to facilitate the transfer of medical information to a current healthcare provider. So under the federal privacy regulation, the healthcare provider can now directly request protected medical information, and a written authorization from the patient now is not required with the information is used for when the information is used for treatment purposes. So this ends this part of this recording, and then in our next recording we will talk about the users of health records.